Hi, I'm Dr. Ahmed Shim. I'm a cardiac electrophysiologist, and I'm part of the Franciscan Physician Network. Electrophysiology is a kind of a mouthful for people, so the best way I can describe myself is a heart electrician. So I usually deal with electricity of the heart. Anytime there's any abnormalities in this electricity, electrophysiologists or clinical cardioelectrophysiologists are in charge of fixing this issue. Whether you need a pacemaker, whether you need an ablation, whether you need a defibrillator, this is something that we address and try to, as much as possible, fix it and make it. The goal is to improve the quality of life for the patient, and that's the most important part about it. To me, it's all about the patient has to build trust with the physician. I don't make the decision for the patient. I discuss what options we have, and I'll have the patient make the decision based on what makes them comfortable with this process. So if you need a procedure, I'll explain the procedure for you properly and explain other options. Medical approaches have procedure and has medical wise. And whatever the patient's comfortable with, that's his choice, and that's what I will go with. One of the reasons I enjoy what I do is actually the outcomes that we get from procedures. So knowing when you go in and you find what you're looking for and get rid of it to improve the quality of the patient's life, that's what's the reason why we do these things. So the reason why I decided to choose Franciscan as a place to continue my practice is one, the collegial approach that this hospital has. Having a well-integrated system of different type of specialties within one place improves patient care. And that's one of the reasons I decided to choose this place. So when I'm not in the office, my wife and myself, and as well as my daughter, we like to do cycling, outdoors, park walks, hiking, stuff like this is also something I enjoy doing. So one piece of advice I always give to my patients is to make the proper lifestyle decisions to improve their quality of life. We physicians are here to help you out. However, it's not based on the physician only. This is basically a team that requires an input from me and an effort from you to improve your quality of life and to help you overcome some of the diseases that you have.